Breast stimulation and removing milk from the breasts are the two most important factors in maintaining a rich milk supply. Breast milk has many benefits for your baby, whether you breastfeed or use a pump. If your milk supply is low or you are unable to breastfeed after birth, depending upon how frequently the pump is used, you can expect them to work 1 to 2 years. Most efficient pump and can keep up an adequate milk supply for a baby's full nutritional needs. Wash your hands properly using soap and water before pumping. Remember, pumping should not hurt. Breast stimulation and removing milk from the breasts are the two most important factors in maintaining a rich milk supply. When breastfeeding is not possible for certain reasons, a breast pump is a device that allows a person to express milk from the breasts. Breast milk has many benefits for your baby, whether you breastfeed or use a pump. Many people choose to use a breast pump so that they can continue to provide breast milk while away from their baby, for example, when returning to work or school, or if their baby is hospitalized. Today in this video, we will discuss the use of breast pumps and the storage of breast milk. When do you choose to pump? If your milk supply is low or you are unable to breastfeed after birth, signaling your breast to make more milk. To maintain your milk supply when you are away from your baby. If you decide to feed your baby with a bottle instead of breastfeeding, or if you want your partner to help feed the baby, these are the most common reasons to choose a pump. You may want to wait to buy a pump till the birth of your baby to get a better idea of your needs, as breast pumps vary in cost, quality, and efficiency. Types of breast pumps. Personal single-sided pump. Suitable for the occasional user, like when another caregiver can feed the baby from a bottle. Pumping both breasts with a single-sided pump takes approximately 20 to 30 minutes. Not recommended if you need to maintain your milk supply while working or for a premature baby. Personal electric pump. Suppose you are at work or traveling, and sometimes you want to use pumps in addition to direct breastfeeding, then this might be a great choice. More portable and can be used several times per day. Not as effective as a hospital-grade pump in establishing and maintaining milk supply. Depending upon how frequently the pump is used, you can expect them to work 1 to 2 years. Hospital-grade electric breast pump. In situations where your baby is born premature or hospitalized and cannot breastfeed immediately after birth, a hospital-grade electric breast pump is recommended. Most efficient pump and can keep up an adequate milk supply for a baby's full nutritional needs. Used to pump both breasts simultaneously, can also be used on one breast at a time. Approximately 10 to 15 minutes to empty both breasts, but this may vary. How to pump. While pumps have specific instructions for use, the following are a few general recommendations for the use of a breast pump. Wash your hands properly using soap and water before pumping. You can also use hand sanitizer if hand washing is not feasible. Clean the controls on your pump and any nearby surfaces. Make sure that the milk collection container and other parts of the pump are clean. You can clean them with soapy water, rinse them, and allow them to dry. Pump parts other than tubing can be disinfected using steam or boiling water. Remember, pumping should not hurt. Set the pump's suction strength to a comfortable level. Cone-shaped pieces that fit over the breasts and nipples called as the flanges. Make sure that they are the appropriate size. If your breast size changes as your milk production increases or decreases, you might need to change the flange size. Seek the help of a lactation specialist if any pain or discomfort in using breast pumps. A special bra or garment with holes or flaps that hold the flanges securely in place, allowing hands-free pumping, can be used. Letdown. Letdown, also called the milk ejection reflex, is the term used to describe what happens in the breasts when milk is released from the milk glands into the milk ducts. Letdown usually occurs within the first minute or two of nursing or pumping. If you have difficulty with letdown while pumping, try. Gently massage your breasts before pumping. Apply a clean, warm, wet cloth to your breasts before pumping. Pump in a quiet, darkened room to avoid distractions. Look at a picture of your baby or smell the baby's blanket. Warm the flange of the breast pump with water or wrap a warming pack around the flange. Expressing milk without a pump. You can also use hand expressions if a pump is not available. It is also an easy way to collect colostrum if you are separated from the baby the first few days after the birth. Before starting, make sure you have a clean container with you to collect the milk. Gently massage your breasts with your hands and fingers to start the milk ejection reflex. Hold your breast with your fingers and thumb in a C shape positioned behind the areola. Express the milk with this movement. Press your fingers and thumb back toward your chest. Compress your breast between your fingers and thumb, moving toward your nipple without lifting your fingers off of the breast. Release without moving your hand. Repeat this compress and release process while moving your hand around your entire breast. Initially, it will start with a few drops, and flow will increase later after a few minutes. Hand expressing milk may take 20 to 30 minutes on each breast. Storage breast milk can be stored at room temperature for up to 4 hours, or in the refrigerator for 3-4 days. Milk should be stored in small amounts, like 30 to 120 milletine, and labeled properly if the baby is hospitalized. I hope you enjoyed this video on breast pumps and the expression of breast milk. Do not forget that exclusive breastfeeding for 6 months is recommended. Do not give any other food other than breast milk for the first 6 months of life, except prescribed medicine. If you have any queries or doubts, drop them as a comment below. See you in the next one. Bye-bye.